Anthony is from Qventus, which is a patient flow automation solution. So they basically use AI, behavioral science, and all of other clever tools to help healthcare systems. It's a great sort of Silicon Valley startup story, data analytics. They've raised over $45 million. They have a lot of healthcare system clients, as you've seen, and we can watch. They introduced a whole bunch of new tools, which we're going to now see to help hospitals deal with the COVID pandemic. Anthony, take it away, please.
All right. So today I'm going to talk about how Qventus is helping over 1,100 organizations manage through the pandemic. We are the first real-time operations solution for healthcare. We combine AI, behavioral science, and operations management best practices to improve healthcare delivery over 120 organizations around the country. When COVID hit, we worked closely with our partners to develop a suite of new solutions to help them manage through the pandemic. The solutions include both capacity management tools as well as critical resource planning capabilities. For capacity management, we created two solutions. First is the critical resource mission control, which gives real-time visibility into ICU, negative airflow, and ventilator resources across the system, spanning multiple facilities or instances of EHRs. This allows users to look system-wide or drill down into individual buildings to better load balance and optimize resource deployment. Next, we've got the capacity creation solutions, which use machine learning models to identify 25% more patients who are ready for step down or discharge than care teams normally would. Finally, we've got the planning solutions here, which help health systems predict what's going to happen with COVID. It's the core of which is the COVID scenario planner, which is the predictive foundation driving the elective surgery planner, the PPE planner, and the post-acute demand planner. So let's take a look now. So this is the scenario planner. It's a highly custom localized model that combines machine learning and 450 unique epidemiological models to predict COVID impact and demand for individual hospitals around the country. You can see right here, I've got Northwestern loaded up, my hometown of Chicago here, and we're going to predict and look at what the COVID admissions are by bed type. So we've got med-surg and ICU beds here, as well as the demand for ventilators and PPE. The tool pulls in the latest publicly available information on any hospital that you select. So we'll get beds and so forth. We'll also get the latest case counts, testing data, and other information to inform the models. The dotted lines here show when we're approaching or exceeding capacity for each of these resources. And then on the left side, we've got multiple sets of parameters you can adjust, from social distancing policies to different epidemiological inputs to build your scenario. And so as you build a scenario, you can save those here. And I've got 3 loaded up today, ranging from a mild case to kind of the worst case here in Chicago. So let's go ahead and take a look at the worst case scenario where we see surges resulting from holiday gatherings in the coming months. All right, so you can see here that as I've loaded this scenario up, some of my inputs have changed. We begin to exceed capacity for med-surg beds here, as well as for the ICU. And then with these controls on the left side, allows healthcare leaders to do some game boarding and scenario planning to help mitigate running out of capacity. So for instance, if we can increase mask compliance, or if we get access to an additional 500 PCR tests per day, what can that do for our capacity? So I'm going to rerun the model here, and you'll see that it'll get us a little bit more breathing room on the med-surg census. I think GoToMeeting is kind of making my computer go a little crazy here, but once that loads, there we go. You can see that there's a little bit more breathing room under the med-surg capacity, but we're still running out of ICU beds in about 6 days. So then what we can do is we can hop down to the hospital inputs and add some surge capacity. So let's go ahead and add an additional 50 beds of ICU capacity and bring online another 25 ventilators to help us handle the incoming surge. And as that runs, it'll create some additional headroom in the ICU so we don't actually run out of capacity, as well as with the ventilators. And so this scenario then can be saved, and it drives the inputs into the surgery, PPE, and post-acute planner. So let's go ahead and take a look at what a worst case scenario might look like here in Chicago from a surgical capacity standpoint at Northwestern. So you can see as demand builds, it'll show you what types of procedures you can perform based on how you've configured your operating rooms. So we can perform some med-surg admit surgeries before the post-Thanksgiving wave of demand hits us, and then we can resume those as we're in between the kind of December wave and the downside of the Thanksgiving wave. We can't resume ICU admit surgeries until sometime in January based on our current predictions. Scrolling a little further down, we can see what the census looks like by type of patient. So here's that purple is the patients receiving those elective cases. The gray is our COVID census over time in the med-surg unit. And so all this integrates together. These capabilities allow our customers to tightly manage their surgical procedures and maximize their revenue while it's safe to do so, providing much needed cash flow to offset the economic challenges of the pandemic. So that's an overview of how we're helping healthcare organizations manage through COVID, and we've achieved meaningful outcomes. Our model has proven to be 2 to 10 times more accurate than other widely known models, such as the University of Washington's IHME model, commonly referenced by media outlets and federal and state officials. Moreover, we're proud to have helped more than 1,100 organizations throughout this pandemic, from health systems, local and state health departments, to the highest levels of the federal government. Early on, we worked to support the White House COVID task force and are now working in conjunction with Deloitte to support the Department of Defense from a pandemic and emergency preparedness perspective. Most importantly, though, health systems have been able to use these solutions to optimize their operations and better support the communities they serve. Here's a quote. Qventus developed an amazing predictive model that projects COVID cases and our enterprise-wide capacity, allowing us to optimize our OR utilization. It's been a tour de force. It's remarkable. Over the last 8 months, COVID has made our mission, which is to enable world-class operations in healthcare, more important than ever. And we're grateful to have been able to partner with so many organizations to make a true difference. Thanks.